Hi, my name is Jay Mathews, and I have the pleasure of presenting here at NCVH Digital Education Series on the safety and effectiveness of the Stellarex drug-coated balloon with low-dose paclitaxel. These are the 4-year results from the ILLUMENATE RCT studies. Now, just a review about the Stellarex drug-coated balloon design. The goals of this device was to limit drug dose, limit drug loss, and allow for high deliverability and high drug transfer. And at the end of the day, offer a lot of clinical performance. This was accomplished by combining two characteristics of drug-coated balloons. One is using amorphous paclitaxel and combining it with crystalline paclitaxel. Some drug-coated balloons may have one characteristic more so than the other, but the Stellarex design balances this out. The amorphous feature allows for prompt bioavailability of paclitaxel into the tissue, while the crystalline nature also allows for optimal tissue residency. And by pegylating this, it allows more durability during handling and inflation. And this also allows for slow dissolving of the paclitaxel to prevent loss during transit and while getting to the actual tissue delivery site. And also it allows you to keep the drug doses low overall in comparison to some of the other drug-coated balloons on the market. Now, the program with regards to Stellarex is quite large. There were 9 studies that evaluated the Stellarex drug-coated balloon extensively, and all the trials met their primary safety and efficacy endpoints. So over 2,300 patients were treated above the knee in these trials with independent CEC and AE adjudications. Now, I'm going to talk mostly about the ILLUMENATE EU RCT and the pivotal trial as well. And if you take a look at these two studies, fairly large, robust RCTs with 600 patients with 12 and 24-month data published. And 300 patients in the pivotal trial and approximately the same amount again in the RCT from the EU. And if you look at the baseline characteristics, if you look at the pivotal data set, it was actually notable for a fair number of female patients. Also patients with comorbidities like hypertension, dyslipidemia, diabetes, and chronic kidney disease. And also, most importantly, these patients were more real world in nature because they did have over 43% severe calcification, which is rarely reflected in a lot of other studies as well. And if we take a look at the significant difference in primary patency between Stellarex DCB and PTA through 3 years, it remains consistent out at the 3-year mark. If you look at the EU RCT, 67.5% freedom from loss of patency with Stellarex DCB over 59.9% with PTA. From the ILLUMENATE Pivotal trial, 64.2% freedom from loss of patency from the ILLUMENATE Pivotal trial, and then 51% freedom from loss of patency with PTA. So both were consistent and both showed improved patency out to 3 years. Which is quite remarkable. And as I mentioned before, there were very high patient complexities. And obviously these risk factors tend to make the performance of drug-coated balloons worse in general. But they showed that even in patients with severe calcium, diabetes, other types of comorbid vascular disease like coronary artery disease, female patients, patients that were obese, patients with poor runoff and chronic kidney disease all did fairly well within this study and were well represented within the pivotal study. Now, what's most interesting for everybody nowadays when it comes to drug-coated balloons is what's going on with mortality based on that Katsanos data. And obviously everyone is very interested with the effect on all-cause mortality, as this was suggested to be increased in some of the other drug-coated balloons on the market. Now, if we take a look at the Stellarex 2 RCTs, we can see that at 48 months, there is no difference with regards to all-cause mortality between the drug-coated balloon and PTA in either the pivotal study or the EU RCT. And we also noted that the patients had very good visit compliance. So, there was this concern about loss to follow-up in some of the other studies that were reported on in the Katsanos meta-analysis. And you can see here 94% compliance in the EU RCT and 95% compliance in the pivotal study with regards to follow-up. And so this is the Kaplan-Meier curves for both of these studies with the integrated meta-analysis, we can see that the survival is consistent in both studies with no increased mortality with regards to using the paclitaxel drug-coated balloon with Stellarex. So these are the key endpoints at 4 years when we're talking about safety. The composite safety endpoint was really no different between the pivotal study or the RCT. There's no difference with regards to all-cause mortality in either study. And you can see, if you break it down, there's no difference in cardiovascular mortality. There's no difference with target limb major amputation. There's no difference with regards to a CDTLR in either study at 4 years. So the safety endpoints were clearly met, and there is no increased risk, apparently, with use of the Stellarex drug-coated balloon within these 2 patient cohorts. So in conclusion, the ILLUMENATE Pivotal and EU RCT all-cause mortality rates between Stellarex DCB and PTA continue to be similar out to 4 years. The 2 Stellarex RCTs consistently show no statistically significant difference in long-term all-cause mortality rates at each annual follow-up out to 4 years. The ILLUMENATE RCT data continues to show favorable overall safety and efficacy of the Stellarex low-dose paclitaxel drug-coated balloon, even within an extensive complex patient cohort. Stellarex is the only low-dose DCB supported by 4-year randomized data with favorable safety and efficacy to date so far. And on behalf of the ILLUMENATE investigators, I want to thank all the sites and investigators within both studies in the EU and also in the US for continuing to support such a great program. Thank you.